It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
All right, our next guest, Dr. Allie Seal, primary care physician from Evergreen Health Primary Care Monroe. Tech Neck. I guess it is what it is.
Tech Neck, the world of technology. People sit long periods of time at their computers, and they can develop neck problems, i.e., Tech Neck. Do you have it?
I think I've had it for sure. Yes, absolutely.
You might most likely have.
All right, let's hear from Dr. Seal and Shannon O'Kelly.
Dr. Seal, welcome to Health Talk. How are you?
I'm well. How are you?
I'm doing great. I'm excited to have you here. We're going to talk about one of the areas that both you and I work in, you as a physician, me as a physical therapist, and that is what we would probably call Tech Neck. But before we get there, let's find out about you. You recently moved to the area. You're practicing out in Monroe. You're a primary care physician. What is the day in the life of Dr. Seal and your interest in your practice?
As a family doctor, I see everyone, we say, kind of cradle to grave. So I see brand new babies all up through hospice patients. So I typically see patients 8 to 5, but lots of young adults, lots of young families, those kind of things.
Do you have an area in your practice that you specifically like?
I really enjoy working with younger families. I did my training in Utah, and I delivered lots of babies and helped lots of moms learning to breastfeed and those kind of things. So I'm really passionate about kind of the younger families, teaching people to be parents, those kind of things.
That's exciting. I mean, I've always had a lot of respect for family physicians. I mean, what I admire about what you folks do is you really take care of the whole person, and not just from the medical standpoint, but also from just child raising, problems at home, parenting, etc. It's a huge gamut, and you know a lot of stuff. But we're going to talk about today, you work in Monroe, and I know that Monroe has a lot of people in the high-tech industry. That area has really grown quite a bit.
Yes, yeah.
And yeah, it's a growth area, and a lot of people are working in software industry or tech industry, and they sit at their desk all day long, and they developed what we call Tech Neck, or probably what we would call also a postural dysfunction. Tell us about that.
Right. I'm seeing lots and lots of younger, early 20s, early 30s adults coming in complaining of tight neck, headaches, those kind of things. And one of the things we talk a lot about is the amount of time that we all spend in front of a computer or looking down at our phones nowadays. And so a lot of what I talk to people about is working on, stretching out your neck, good posture, those kind of things, and just kind of the consequences, I guess, of the overuse.
Just sitting all day long, and when you sit all day long at a computer or use your phone, we have gone from an active society or an agriculture society to a high-tech sedentary society. And they talk about sitting for long periods of time is like equivalent to smoking 2 packs of cigarettes with no activity. But maybe we should talk about the anatomy of the neck a little bit. And people don't realize your head, it's got a brain in it.
The brain is heavy.
It's heavy. It's really heavy, and it's all water, so it creates this heaviness. And when that head gets out in front of your body, gravity's trying to pull that head down to the ground, and you have these neck muscles up here that are trying to keep that head upright. And they work, and they overwork, and they get tight, and they develop what we call postural dysfunction, myofasciitis, trigger points, tension, et cetera, et cetera. Let's talk about that a little bit.
Most people, kind of as we're looking at our phones or looking down at our computers, we tilt our head about 15, 20 degrees, and every degree that you're tilting adds more pressure to your spine. At 15 degrees is an extra 30 pounds, which is, an average toddler size, just kind of sitting on the back of your neck. If you're looking at your phone down in your lap, that's 45, 60 degrees, that's 50 or 60 pounds extra pressure on the back of your neck.
Yeah, this is good. We're doing a little physics here, folks, and that's what we're doing right here. So the reality is as your head gets further out in front of your shoulders, gravity's pulling that down, and that lever arm changes, so the weight and the pulling increases. And those muscles in your neck aren't really designed to do that kind of lifting, that kind of strain all day long. And over a period of time, they start to splint and guard. They get tight. That's where the tension comes from, and maybe the headaches and just the stiffness. And then it kind of just develops through the whole body because you change your posture, you change your low back posture, your shoulder posture, et cetera, et cetera.
Right. I talk to my patients. I'm like, it's all connected.
Yeah, exactly.
And so if your head is out of line, you're going to start compensating. And so we talk about, it's not just keeping things in line up top. That's where a lot of low back pain and, even leading to knee pain, foot pain, it's all connected.
More with Dr. Allie Seal and Shannon O'Kelly talking Tech Neck right after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Dr. Allie Seal is a primary care physician from Evergreen Health Primary Care in Monroe, and she's talking with Shannon O'Kelly about Tech Neck.
Dr. Seal, thank you again for joining us on Health Talk. And again, welcome to Monroe.
Yeah,
we
thanks.
talked about that area out there and how much it's growing and how much technology is out there and people that work in the tech industry. We're talking about tech neck or a postural dysfunction. Let's talk about intervention, because it's really important that we get in there and change that positioning from an ergonomic standpoint, et cetera, et cetera. Let's talk about that a little bit.
Yeah. In 2019, everyone is always asking me, what app can I use or what kind of device can I get to help correct this? And I tell them, this is one place you've got to put in the work. So there's no bracing really that's going to help. If anything, it's going to make things worse. You need to train those muscles to pull everything up how they need to go. So I recommend a lot of people go to physical therapy. A lot of it's years of bad posture and not good ergonomics, leading to tight muscles and weak muscles in other places. And I have enough expertise to tell them that they're messed up, but not enough to tell them exactly how to fix it.
Yeah, you make a good point. There's not the simple pill or the brace that they can put on. It is all about work, movement, mobility. I'm glad we're talking about this, because as a physical therapist, this is our wheelhouse, movement and kinesiology, body mechanics, etc. You got to get that movement going and change positions, because if you stay in that position, that posture, those muscles shorten. That's a natural tendency for muscles to shorten.
Right. And I tell people we're never designed to sit still for as long as we do. Society kind of dictates that we sit at our desk for a long period of time to get work done, but that's not the way that God made us.
Right, yeah, exactly.
So kind of getting up at least every hour, moving around, doing some stretches, or just some really basic things that people can do.
Yeah, just basic, like looking at your monitor height. Looking at your chairs set up. What are your hips doing? Even changing the level of your hips changes your low back, which changes your neck. That old song, when I was a kid, we used to sing this song, head bone connected to the tailbone or whatever it was. The body is connected. It's the kinetic chain, we call it.
One of the other things, too, is even with looking at your phone, trying to hold it up at eye level rather than looking down. It's one of the things I tell people, you're going to look like a grandma walking around with your phone in front of your face, but it'll prevent you from looking like a grandma later on with a hump at the back of your neck.
Yeah, exactly. So you want to watch that posture, and you want to watch positioning all the time.
Yes.
Dr. Seal, as a family physician, we talked about you taking care of the entire family. I'm sure you see another area is new mothers that are maybe, or fathers that are bending over to get the baby out of the crib. You're holding the baby, you're breastfeeding, et cetera. That's a lot of posture dysfunction right there.
Yeah, with new moms with nursing and kind of looking down at baby and that rounded shoulders that you do, and even dads when they're bottle feeding.
Right.
Sitting in bed, we have this certain posture when you're looking down at a little baby. Lots of new parents I end up sending to physical therapy just because they do a lot of damage to their neck and their shoulders.
Exactly. As we wrap up here, thank you again for your time, but I do want to give you a shout out. And I sent a friend of mine to see you the other day, and they called me back up and they said, amazing. Dr. Seal spent so much time with me, asked me so many questions. I've not had that experience with a physician in a long time, and I appreciate that.
Well,
and
thank you.
So did they. Yeah.
My philosophy is to treat everyone like my family. And so I've got all my family down in Texas that they're being cared for by other physicians, and I want them to be treated that way. And so I treat everyone like they're my mom or dad or sister, kind of the exact care that I would want them to have.
It's kind of connected there. Treat them like family. You're a family practice physician.
Right.
Good job. Thank you so much for your time.
Thanks for having me.
It's amazing, Shannon. There's been all kinds of things that have developed since the dawn of the technology we use.
Tech neck, BlackBerry thumb, you name it, we treat it. Technology's great, but it does cause some situations.
All right, thanks to Dr. Seal once again. You can get more information, evergreenhealth.com/primary care Monroe. Final segment after this. Time out.